In this video, we will learn about gastric balloons for weight loss. We'll find out what they are, who are they meant for, how are they inserted, the complications related to gastric balloons, how long do they stay, and how they removed, the efficacy in terms of weight loss, and how does a gastric balloon compared with other measures for weight loss. This is a cartoon of the stomach that demonstrates a sphere filled with green liquid. This is the principle of a gastric balloon, which sits inside the stomach, and by doing so, it reduces the appetite, it induces a sense of fullness, and it reduces the transit time of the food through the stomach. In this cartoon, you can see that the back of the throat is where the gullet starts and then it leads to the stomach. Balloons may be swallowed in an empty state, or they can be inserted using endoscopes, which are flexible tubes that go through the mouth with a camera at the end, carrying the balloon with them and then positioning these inside the stomach. And once inside, there are special delivery systems using the endoscope to inflate the balloon. In this slide, we can see the various balloon systems that are available, and these include the Orbera, the Obalon, Spats, and the Allurion. Outlined also is the balloon material, which is mostly silicone or a combination polyurethane or nylon polyurethane, the various media such as liquid or gas, what is the volume of the balloon, which varies from 400 to 700 if it is a single balloon, or if there are multiple balloons then up to 250 mils for each balloon. The duration of treatment, mostly 6 months, but can be as low as 4 months or 12 months, and how these are inserted, whether using endoscopy or swallow endoscopy. Interestingly, the Allurion requires swallowing only without endoscopy. Common adverse events, up to 91% of people may feel these, and include nausea, vomiting, pain, reflux, burping, dyspepsia, and constipation. These are very common, especially in the first week after the balloon insertion, and patients are warned about this. And the treatment includes a proton pump inhibitor to reduce acid, and anti-nausea medication to control the nausea and vomiting, and an anticholinergic medication to reduce the amount of secretions in the stomach. Once the stomach accommodates and gets big enough for the balloon, then these symptoms settle down. Less than 1 in 10 patients would continue to suffer these past the first week, and only about 3 to 100 out of the patients treated would require removal of the balloon due to ongoing symptoms. For unethical practice, these complications can be much higher and more dangerous. Serious adverse events related to the balloon are very rare, but include those that are related to the balloon, such as migration. So the balloon actually migrates away from its intended site of stay and may cause obstruction at the outlet of the stomach, requiring the balloon to be removed. Rarely it can get bigger in size, giving rise to severe symptoms, or acute pancreatitis when the migration actually arrives at the outlet of the pancreas tube, giving rise to pancreatitis, or rarely by direct pressure on the pancreas, which is behind the stomach. Procedure related typically occur when the balloon is being taken out. There may be tears in the gullet or the esophagus, bleeding as a result of a tear, and rarely a perforation itself whilst trying to drag the balloon material out. Mortality is exceedingly rare, although occasionally reported. So once a balloon is fitted, what other adjuncts can be carried out to improve weight loss? And these include weight loss medication along with a balloon. This treatment can be repeated with reasonable outcomes. There are balloons that are adjustable. An intragastric balloon for patients with severe obesity may allow an initial weight loss, which can then further improve the chances of patient having a successful and safe weight loss surgical procedure. So what would you expect after having a balloon fitted? How much weight would you lose? Typically between 6 to 15% of weight loss may occur with the use of a balloon. There is a geographic variation around reported weight loss. In the US, after 6 months of balloon therapy, it's around 10%, whereas in Brazil it is higher at 18%. It's important to realize that once the balloon is removed, patients tend to put weight back on. The most loss happens 1 month within their balloon therapy, and once the balloons are removed, only 50% of the patients maintain 20% weight loss, and this figure then drops to a quarter of these patients at 5 years, and around 10 years the effect of the balloon therapy for 6 months initially is no different than diet and exercise, so that most patients will require another form of treatment for weight loss. A very broad comparison of weight loss with balloon versus other therapies For the balloon, it is 65%, but unfortunately, once the balloon is removed, most patients will end up putting the weight back on. Diet and exercise alone, what's called multimodality treatment, 2 to 9%. Medication or drugs, especially the newer ones, can achieve a weight loss of up to 15%. Surgery, such as sleeve gastrectomy or bypass, has been associated with a more permanent weight loss of up to 30% of the total body weight. These figures are very approximate and may vary from patient to patient. So who should not have a gastric balloon fitted? Those who've had previous gastric surgery, coagulation or bleeding disorders, especially related to the stomach, alcohol or substance abuse, pregnant women, those with severe liver disease, and those who cannot have endoscopy for other reasons. So who is most suitable to have the gastric balloon, which is an interventional procedure? It is associated with significant symptoms in the first week with a small risk of complications. The first thing to mention is that weight loss advice must be available to all those who are overweight or obese, which includes but is not limited to appropriate counseling, diet and exercise advice. Now, the true place of the balloon is not very clear in the treatment algorithm of obesity. It seems it is best suited for those who require short-term weight loss. In general, in Europe, a BMI of greater than 27 and in the US, a BMI of greater than 30 is deemed appropriate for this treatment. This completes this brief video. If you have any comments, please do share.